All right. Good afternoon, everybody. This is Dr. Phil Dieter. Welcome back for another episode of Cal Chiro Live. Thank you so much for joining us today. I'm super excited about bringing you another informative guest. But before we get started with that, I wanted to make sure everybody knows, as you should, that we have our fall conference coming up August 28th through 30th. So just a few short weeks away. The room block is sold out. So once again, we've been able to sell out a room block, which is incredible. I always appreciate everybody's support, coming out to the events and things of that nature. So looking forward to a lot of fun at the upcoming fall conference. Great speaker lineup. We had one of our speakers the other day, Dr. Brad Glowacki, join us on the live broadcast. And I do have a special guest speaker next week coming at you, Dr. Dan Murphy. I'm going to start teasing it right now so you could spread the word, help me spread the word, share with your friends that Dr. Dan Murphy is going to be on the live broadcast with us, which is unheard of. They told me it couldn't be done. And if you know me, when somebody says, oh, you can't do something, I'm like, oh, well, time out. Let me see what I can do. So super excited about next week. And then, of course, we're going to try to raffle off some money today. Hopefully you saw that as well. In fact, you may not have seen that. We had to do a little bit of a change in our marketing this time around. For whatever reason, they don't like it when we say we're giving away money on the live broadcast on Facebook and Instagram and things of that nature. But as you know, we're always here to try to give away some money to our members. They don't want us to promote gambling. We'll have to try to modify our messaging a little bit, because I certainly know there's a bunch of gambling touts out there and fantasy sport gurus that are advertising those kind of things. So we'll figure out a way to work around it, but let everybody know we're still giving away money here. So, but I wanted to bring today's guest on before we get too far down the road on all this stuff. Let me introduce you to Dr. Chris Oswald. Can you see me and hear me, Chris?
Absolutely, Phil. Nice to see you.
All right. Thanks so much for being on. I had the opportunity to interact with Chris and his company at the Chiro Congress event last November. For those of you who haven't been to Chiro Congress, I'm sure Chris could share. Incredible event, great opportunity to meet people within different chiropractic associations and things of that nature. But Chris, why don't you just tell us who you are and the companies that you have?
All right, Dr. Phil, thanks for being here, and thanks for having me here. My background is 37 years as a chiropractic doctor. I was trained at CMCC in Toronto, Canada. Started my own practice called the Center for Fitness, Health, and Performance back then, which has grown to be the largest multidisciplinary practice in the country. And along the way, I was really frustrated that most of the things that we were doing as chiros didn't have a lot of evidence behind it. So I knew we were building more evidence around, lower back pain care, neck pain, etc. But when we were giving products away, for example, we're giving away pillows and back supports that, again, didn't have one clinical trial. Stretches, for example, the little stickmen that we used to give out from Bob Anderson years ago, those, he developed that in his basement in California. And those, again, were 5 to 10 second stretches. Again, if you look at that, there's absolutely zero evidence. So I thought, what I need to do for people to take us seriously is start making a dent and a difference in public-facing information, whether it be a book that I write, which I did, a best-selling stretching book, because I want to make sure that everyone knew to hold a stretch statically for at least 30 seconds, and if you do it more frequently, it's better. And if you hold it till it releases that stretch reflex, it's even better. So these are the kind of things I wanted to get across. That was back in 1998. And along the way, then we got frustrated because people would come to us and they would buy pillows from us, for example. And they get so frustrated because one time they were perfect feeling. Next time they were hard as a rock. Next time they were soft, right? You guys seen this before because there was no standardization. So what we did, we developed our own foam, make sure that was standardized. And we had a double curvature, but a longer trough in the middle to allow the head to actually lie properly flat. So the bridge of the nose was parallel to the ground, if you will. so that you can actually get normal, perfect unloading or offloading of the neck joints and have a comfortable sleep with no compression. So we did that. We did it with 2 different sizes of risers under it as well, so that with one SKU or one purchase, you could fit 95% of the population. So it wasn't as confusing as the other brands that had 16 different sizes that you never got right in the store. So we did that. We evolved that into lumbar supports, back supports, and we did studies on all of them to make sure that they actually worked and we could actually make clinical claims. Then we got into mattresses, the whole bit. From there, we evolved into topical pain, and everybody knows that we developed muscle care, because in that space, that's what's crazy about it. Those topicals don't have any evidence behind them. So we said, well, why are you making claims that it works? And what's so good about a sensorial that just cold that would block pain for a short period of time? What's good about that? Well, all the pharma companies will say to you, well, that's okay. That's the gate theory of pain. It's a distraction method. And they're trying to sell you on the fact that that would distract your nervous system and actually cause your nervous system to adapt or change. Well, that doesn't really happen. All it does, it's like, remember I said before, it's like if a 2-year-old is crying at you and you ignore it, it cries louder and longer to get your attention. That's the same thing that the nervous system does. And this is what's frustrating for me, because I want to help people get out of pain. But if you ignore it by just temporarily masking it with something cold, it's going to start firing louder and longer to get your attention, creating a well-established pain pathway. And that doesn't make us look good. So that's why we developed muscle care, because we actually created a bioinnovation that takes magnesium and 6 other ingredients into a tissue and relaxes that actin myosin in 30 seconds. So you can get natural circulation moving out the inflammation that was actually triggering the pain reflex, and you can break that cycle. Again, paralleling with what chiropractors have always said, we always get to the root of the problem. Let's not mask things. So that's where we spend a lot of our time, is actually trying to change the way people perceived us with respect to the products that we endorsed or put in our practices.
Okay.
And then we just evolved from there. I'll tell you more, if you want to hear more about the job business, in 2010, one of my colleagues, Dr. Sid Lissler, who'd been with me for 15 years or so, came up and said, Chris, we're getting so many job patients, more and more every day, but we never really had any proper training at school. And if you ask around, all the chiros will say the same thing. We got about an hour and a half. Sure. It needs way more understanding. It's like learning Mandarin, and it can't be cut short. And this is why a lot of you, like me, we would try adjusting a jaw sometimes. And again, sometimes it would release, sometimes it would work. Many times it wouldn't. You didn't even know what to do. So you just do trigger points or soft tissue work. Sometimes you do acupuncture. Sometimes you do laser. Well, what we did was we agreed together that in 2010, we would create the Jaw Center. And that the intention behind the Jaw Center was to take as long and as much investment as it needed to make sure we understood the jaw. And if you research it and reference it, took us 8.5 years. But we were building a protocol and a process based on research that shows manipulation of the jaw has no supporting evidence. Soft tissue does, yes. And the brain of a chiropractor, mechanical brain of a chiropractor, is perfect for this particular category, because the MSK or TMD issues in the jaw are the fastest growing mechanical condition on the planet. They're about 34% of the adult population.
Wow.
Think about it. That's 1 in 3 people that go to the dentist, and the dentist is not trained in this. It's a great opportunity for us. So get a load of this, Phil. In 2019, just before COVID hit, Dr. Sid's buddies were all dentists and dental surgeons at Mount Sinai's oral facial pain division, and they had 2,000 patients. This is a true story. They had 2,000 patients on their waiting list just before COVID smashed us. They didn't know what to do with it. Guess where they went?
Chiropractic offices.
They went to us. One of our main headquarters at Yonge and St. Clair in Toronto got 2,000 new patients in a matter of 2 weeks.
Wow.
Can you imagine, you guys? That was absolutely,
handle that.
It's insane. I mean, we had a number of practitioners. We had 6 that we'd already trained, but that wasn't enough. So we just kept growing. Now we have 17. And over the course of that 4 years, we developed relationships with 800 dentists around our practice. And take a guess how many new patients they refer the practice on average every month.
50?
260.
Every week.
Every month.
Okay.
Every month. So 260. So this is what was actually mind-blowing, because I'd seen 30,000 patients in my career. We'd had a very, very busy practice, lots of practitioners doing well, but never in my life. Have you ever seen that kind of referral pattern?
That's incredible.
So that was great for us. That told us that if we could actually, and we did, we proved that we were reliable and reproducible in the way in which we were treating the jaw, diagnosing and treating and exercise stretches that we all created, that we could get about an 80.6% success rate in symptom improvement and in functional improvement within phase one. And we call phase one 2 15-minute visits a week, 3 days apart, soft tissue work and rehab. That's it. No manipulation, no
Okay.
other modality for 6 to 9 weeks would get that type of result. And that's what's gotten so exciting. And then we've got so many people across the country. And that's where I met you at the Chiro Congress in Denver last fall.
Yeah.
We had 34 states that want to do that program because it's just, again, not only from a business perspective, but filling a niche that we haven't been able to fill and nobody else has. But what I love more about it, and I think you're thinking the same thing, that if we can get patients in our doors from dentists, not from social media per se, but from dentists that are respected members of these people's lives, they're going to listen. Okay. They're going to do what that dentist suggested. And we're going to get fantastic collaboration, So that's really what we're doing. We're spending most of our time, training and teaching people in oral facial pain.
I love it, man. This all sounds so exciting. I got some more questions for you because I want to understand, how do you come to that diagnosis, that TMD diagnosis, or how do you come to the correct diagnosis?
Wow, that's a big one because I'm not necessarily the best of the best. Dr. Sid Lisser, my co-CEO, he is the best of the best. He's the jaw guru. And he'll say to you that what it comes down to is the course that we teach, believe it or not, is 16 hours of live, hands-on, and academic. So split about 50-50. But there's 450 slides. Every one of them is research-based. So instead of me telling you, 450 slides right here, what I can say to you is that there's 5 or so conditions. There's the grinding, there's the clenching, there's the pain, there's the clicking, these sort of phenomenon. It really comes down to, I think, understanding the disc mechanics. And that, if you think about it, that was what's so darn confusing for most of us that have very limited knowledge of a jaw. This disc is moving in a very funny way. And believe it or not, it does sublux or distort way more commonly than does a spinal disc. Okay. So understanding the discal mechanics is really, I think, critical in getting the right diagnosis and then ruling out the red flags, because there are other things that can go wrong with the face. We all know there's other glands, et cetera, that can, have other health issues going on as well. So we want to make sure we rule out red flags, and we learn how to rule out odontogenic, which means tooth or gum related. So you're acting like a dentist in a sense, screening. You have to know the teeth. You have to know how to do that. It's not hard. It doesn't take very long. But as long as you've done that, you're much more apt to become much more targeted on an MSK situation as a primary issue or a secondary issue, and be able to treat it based on knowing the diagnostics, the way that they're going to teach you. So that's
what are some of the red flags that we should be on the lookout for?
Well, I mean, obviously, with people holding the phone by their face, it's way more common than you would imagine. I believe cancer in the parotid, in that area is 1 in 100. It's ridiculously common in this day and age. So we have to watch for that. Okay.
I'm sure that's a big one. Yeah,
it is. Again, when we say red flags, we're generally referring to, carcinoma of some type. But the best part about this is that you're getting much of the diagnostic help is from the dentist community. So they're going to send you the Panoracks, the PET scans, the CAT scans, the MRIs, and you learn how to read them, but they also send you the reports. But together, you become a diagnosing machine to really help figure out all aspects of that oral facial pain problem.
How about trigeminal neuralgia or Bell's palsy? Is that contraindicated?
Is it contraindicated? Not contraindicated per se. I mean, I believe that in that case, it probably isn't a TMD or TMJ problem. But however, it doesn't mean that there's not going to be spasticity or dysfunction in the facial or jaw tissues. So being able to address those this way could help. Again, everybody's going to be different, as you know, but
Yeah.
cervical adjusting has had some empirical evidence to benefit Bell's palsy. I've seen that myself, but
Hmm.
that one's a tough one because there's not a lot of evidence on a longer study with bigger numbers to say, hey, let's just do this. But I would
Sure.
imagine that because of the numbers we're seeing, we're going to be able to make comments about these things that are giving us frustration. Like, for example, tinnitus, ringing in the ears, this sort of
Yeah.
thing, right? There's a heck of an association between jaw and ear. So we do go into that in depth as well.
I love it, man. This is such an interesting topic for me. I guess, like you said, it's probably part of the diagnosis or part of the treatment plan. It complicates it a little bit more. I actually taught anatomy for 7 years at Life West Chiropractic College, and I taught head and neck, and we always dissected the jaw. I'm definitely familiar with the disc and its attachment to the medial pterygoid, and that medial pterygoid massage is so key. So hopefully that's part of your program and teaching people how to do that.
It is. And the thing for us, I believe there's only 4 or 5 states that don't allow intraoral work. But
Okay.
for the most part, we are PACE or CE approved in 45 states. But yes, getting inside of the mouth, the exterior of the mouth, working soft tissue, as we said, key point of treatment or part of treatment for getting people better or on the path to getting better.
And learning how to do it correctly. I think that's a big piece of the puzzle. So we better
Absolutely.
make sure California is one of those states that allows it.
Working on it, working on it. You know, can you
Cool. Well,
imagine? Sorry, go ahead.
no, go ahead. You can finish what you're saying.
I was just going to say, and the reason if someone says to me, why wouldn't you treat it more frequently? Those tissues are delicate, as you've alluded to.
Sure.
When they're off, they're in a lot of pain, inflammation, spasm, etc. So it's not something that they can tolerate longer visits with. So that's why it's only 15 minutes,
Yeah.
and it probably is 10 minutes, 8 to 10 minutes of intra and extraoral work, because that's all you can handle. And when you
Yeah.
first get out of the gate, right? So, and again, having 3 days for it to just adapt, settle, get better. Okay, ready to do it again, right?
It's so complex, man, because I've seen firsthand how the TMJ issues and that kind of thing comes from the clinching, and the clinching a lot of times is happening at night, and then they're clinching because they're stressed and anxious about things, and so it's a multifaceted situation. It's very layered. But I wanted to jump in a little bit to what one of the things that you said about the pain products and being sensorial, and or most pain products being sensorial. I take that to mean just inhibiting the senses, right?
Right.
Whereas your product really addresses the myosin and actin and things of that nature. So could you kind of dive into that a little bit for us and just help us understand how muscle care is different than some of the other sensorial products that we might encounter?
Sure. Maybe what I could do is I could say, we've been in this business since 2008, and we brought in chemists from the pain sort of side of things as well as the cosmetic space. And believe it or not, it wasn't to make something pretty or smell nice. It wasn't for that reason. It was
Sure.
because the cosmetic industry understood magnesium better. And we all know that magnesium is an essential part in muscle relaxation. Without
Okay.
it, we can't get it.
Right.
The challenge is, how do you get it to a muscle that's in spasm? It's almost like it's walled off from circulatory magnesium when you're taking it
Okay.
orally. So we had to create a push technology. That's what we call MyoDrive, if you look us up. And that's
Okay.
pushing through that knot into that deep sarcomere where those actin myosin fibers are stuck together, and magnesium hits it, breaks it apart, and lets that fresh nutrient-laden circulation not only feed the tissues again, but remove the inflammation that was either from injury or the metabolic waste products that are also inflammatory that are creating the pain cycle. So we thought, again, we do it like this. We say there are surface products, sensorials.
Mhm.
There are symptom ones. Some NSAID creams like Voltaren claim to be inflammatory addressing. Okay,
Okay.
that's questionable because FDA still says may work in 1 to 7 days, may work. Okay, but the source is getting down deeper. And if you get down deeper and you relax that muscle, then again, you change pain behavior. But you also, if you have muscles relaxing, it becomes something that offloads the joint. So you can truly get a change in joint dynamics or compression in that osteoarthritic space. So I'm super intrigued with the types of results we've got we had about 2 million users over this period of time, but we'll get letters from people in very small towns that said, I'm on 220 milligrams of morphine a day. I've got sciatica, disc herniation, you name it. I've got it. I'm 54 years old. I can't
Right.
move. Then somehow someone gave them a muscle care or a pharmacist in their area that we don't even sell to. And again, I don't know how they get it, but they'll
Right.
say to me, within a month, I've been able to reduce my morphine by 63%. I'm down to 90. And I love it when I hear I'm walking, I'm going to church, I'm able to exercise, and I'm smiling, I'm with my friends. I love to hear those type of stories because I want to break that dependency on the drugs, getting to the root of the cause of the problem faster. And for example, if anyone watched the NBA finals, where in the very last game, Halliburton on the Indiana Pacers, he'd been playing for 2 games with a partially torn Achilles.
Right.
Partially torn Achilles. And his last game, if you saw him, he was their key 3-point shooter. He leaned way too far forward on that aggravated Achilles, and he
Right.
blew it right off. I mean, these are the kind of things that people are being pushed too far. They're not getting a chance to reset. A better example is probably Steph Curry. He was in the playoffs and he was out for their 2 important final games. Probably one of the major reasons why they lost, because he had a strained hamstring. And I say to myself, an athlete of that caliber with that amount of money in that sport, having a strained hamstring, they couldn't settle down. Well, these are the kind of things if we do this better, we can start to claw back ownership of this space again, because I truly believe that, we had it, but we didn't have the evidence supporting it when we went to the World Health Organization back in 1988. But then we started clawing back, and that the Wilkes case was amazing because all the money went to the Foundation of Chiropractic Education and Research that we won. And I love that, and we're building more and more and more evidence saying that we're better in neck pain, back pain care. But I want to have, like you said, I want to have it as a multifactorial approach that nobody else can touch,
For all of our listeners here, if you don't know what the Wilkes case is, you better go look that up right now, because that's one of the most monumental pieces of judicial decision making that's ever occurred in the chiropractic profession. So
it was incredible.
thank you for that history lesson right there today. But I wanted we're coming up on time. We got to give away some money today, but so I want you to, can you help me understand just a little bit? I'm really just trying to learn here myself today. So this is just all about you and I. I'm learning so much from you. So we've got topicals, there's sensorials. A lot of the like CBD creams and CBD oils are talking about inflammation and addressing inflammation. And then now you've just taught me a little bit more about how we need to address actin and myosin to free up joint mechanics and that kind of thing. Can those things all work together? Does one, is yours a replacement for those or instead of?
Well,
how does that fit?
I'll just answer as quick as I can, Phil, that we have experimented with CBD and THC or both. And because we have a driving mechanism, we can pull anything into the tissue. I can be honest with you all that it didn't make a difference in effectiveness of muscle care on its own compared to CBD or THC. So we did not go with it because one of our studies that was published in 2015 in a medical journal says it's safe to use in pregnancy or nursing. And we couldn't do that if you put CBD and THC in or CBD alone. You can't do that. You can't ship across certain borders. We just really like the idea of being more effective than the leading sensorials, more effective than the leading NSAIDs, and safe to use in pregnancy and nursing. So that's why we stayed in this space, strong and
I love
safe.
it. I love it. Yeah. And I know that a lot of the CBD companies too will talk about, hey, if you got a firefighter, a police officer, or somebody, who's potentially going to get tested, don't mess with that, give them a chance. You don't want to mess around. So I did want to ask you about your certification program. If you could tell everybody about your certification program real quick.
Sure. Just look at us up at the OFPT.com. Okay. Or reach out to me at Dr. Chris at the OFPT.com. Anytime, any questions, happy to entertain. Okay.
Awesome, man. This was super informative. I feel like I got a lot more to learn from you. And I always like hanging out with smart people and that kind of thing. So we'll have to figure out if we can get you out here to California, maybe to do a presentation or a CE or something like that for us. I think that's probably our next step in the relationship. So
Thanks very much.
Um, all right. Well, are you going to be able to hang out while we try to give away some money here?
Of course, of course.
All right. Let's thank you again so much. Let's bring up the wheel and we will try to give away some money today. Again, this is not gambling. This is raffling or something along those lines. So if anyone asks, just make sure we're clear about that, kind of thing. So we're just having fun. We're trying to make it fun. So let's do name. I think we're doing 5 names today. The chat usually helps me out with 5 names. That means I think we got $500 to give away today. Remember, to be a winner, you have to be a member. You have to be on the broadcast. Your name has to be selected at random by the randomizer, and you have to respond within 30 seconds that you are here, and then you will be able to claim your prize. So let's do name number 1. All right. Name number 1 is John Talion. Oh, I know John. Sorry, I'm messing around with all of the trying to figure out the best. There we go. We'll just take our faces off the screen here today. John Talion. There's John. Thanks, John, for John is from Steele and Eisner. They've been great supporters of our organization. Give them a plug. I don't know if John's here today, but John's done a lot for our organization. He goes around to different districts and puts on CE events. If you guys are interested in that, I know I can get John out to your venue and that kind of thing. Or if you have a venue, and I'm sure they'll sponsor a CE talk for you and that kind of thing. Not sure if John's going to be on the broadcast or if he knows that we're doing this kind of thing here today, but that was name number 1. Yes, the Chiropug told me that is name number 1, so I appreciate that. Oh, we're doing 6 spins today. I just found out. That means $600. So it looks like no John. So let's do name number 2. Name number 2. Jay Thompson. Jay Thompson, you are name number 2. I don't know Jay, but let's see if Jay's with us. If anybody knows Jay, reach out to him. Let him know that he's one of our winners today. Hopefully he'll be here to claim his money. Oh, I just got reports. He's from Ventura District. So who do I have on here from Ventura? We've got a board member from. Oh, I see Dr. Wisniewski. She's down near the Ventura area. I think she's in Santa Barbara though, if I remember correctly. So I don't know if you're going to have enough time to reach out to Jay to tell him to come and collect his money, but reach out to him. Tell him he should be on the broadcast because his name was selected. It was so funny. I had one of my students win, I think last week, but she wasn't here to collect the money. And she wanted to know if there was any way to get the money after the fact, because it's always fun when we give money away to students. That's a good time. So, all right. I don't know if I see Jay here today. That was name number 2. I think we're ready for name number 3. Maximus Yapez. I don't know Maximus, but hopefully Maximus is here to collect his money today. I'm sorry, what were you going to say, Chris?
No, nothing. I'm just nodding along with excitement, Phil.
Oh, okay, good. I'm sorry. I thought you had a comment, but where's the next event you're going to be at?
Oh, I'm just setting a new date for a very large oral facial pain program this fall. Oh. I don't have the exact date yet. I had to move a September date, but I will be doing a very large one, and I'll keep you posted. But I was going to say, if anyone that's listening today, if anyone wants a sample of Muscle Care roll-on or ointment, if you send me an email with your name and address, I'll send you my gift today to all of you. How's that?
We'll put your name and your email in the chat, and I think we had a QR code also for that earlier. That was something that Tiffany put up, and I think some people already even scanned that. So that's pretty cool. But let's do name number 4. Name number 4. Barbara Weldon, you are name number 4. Just as I used some Muscle Care last night, actually. I hadn't. I just heard Barbara Weldon has already won once. That's a interesting little twist on things here. Barbara Weldon's already been a winner, and she collected her money. I didn't know that, but good to know. That was name number 4. Barbara, let's see if you're here to get your money again. I think. What I was going to say, or as soon as we get through this, I'll tell you my story about the Muscle Care, and Barbara Weldon responded in the chat. Barbara Weldon is here, which means we have a winner today. $600 to Barbara Weldon. Oh my gosh, there's pandemonium in the chat. Well, Barbara, hopefully you can put that money to good use. Thank you so much for being here. I wanted to remind everybody about our fall conference one more time coming up. Please reach out to Tiffany or Shasta or Dawn if you need anything regarding fall conference or get included in on these broadcasts and things of that nature. Thanks so much, Chris, for being on with us again. Really appreciate it. Here's the code for the scan. No, I do have a question about from the Chiropug. Is there any way we can make it only one-time winners? No, we don't want to do that. We want people that are here coming in for the opportunity to win. So if you are a winner once, you can be a winner again. So tell your other friends. It's always at random. We're not excluding anyone from winning more than once, but hopefully they put the money to good use. So, but yeah, the muscle care was super beneficial last night. Used it on an Achilles for myself and on a lower back for my wife, and could have been happier with the use of it today. So thanks so much, man, for being on with us, and really appreciate you sponsoring the program and all that kind of stuff. So
appreciate you guys too. Thanks everybody for coming out today and just learning more. Happy to help. Okay.
All right. That's very good. Take care.
Take care. Bye, everybody.